Malaysia is heading back into a nationwide lockdown.
Malaysia's king has declared a state of emergency.
Healthcare facilities here are overstretched.
Malaysia is in the midst of its worst COVID-19 crisis since the start of the pandemic. On the 4th of August, the country reported a record high of 19,819 new COVID-19 cases and almost 1.2 million total cases. The entire country is currently under lockdown, people are losing their jobs, and the health system is on the brink of collapsing. It's a huge difference from how the country was doing in early 2020. This time last year, Malaysia was only reporting an average of about 10 cases daily, and it had one of the best COVID-19 track records in the region. As someone with friends and relatives in Malaysia, the current situation is deeply saddening. But as I watched Malaysia's COVID-19 numbers climb daily, something didn't add up. This is how long Malaysia has been battling its third and fourth wave of coronavirus infections. And this is how long Malaysia has imposed any level of lockdown restrictions. In fact, FMCO is the harshest and most restrictive lockdown yet. But COVID-19 numbers remain at an all-time high, with no indication that it's slowing down anytime soon. So what happened? And where did it all go wrong? The start of Malaysia's third wave can be traced back to a snap state election that was held in the state of Sabah. For a 2-week period in September 2020, voters and politicians mingled freely and travelled between Peninsular Malaysia and Sabah for campaigning and polls. On the day of the election on the 26th of September, Malaysia recorded 82 new COVID-19 cases. After the election, thousands of people returned to their home states. Soon after, a spike in coronavirus cases began happening all throughout Malaysia. On October 1st, 2020, Malaysia broke their record for highest ever number of cases recorded in a day. 4 days after that, that daily number doubled. Barely a month later, Malaysia blew past the 1,000 daily case mark for the first time. On October 24th, 4 weeks after polling day, Sabah became the first state to hit more than 10,000 cumulative COVID-19 cases. It's hard to pinpoint exactly how things spiraled out of control, but here's a few potential reasons. On January 11th, 2021, Prime Minister Muhyiddin announced new nationwide movement restrictions for 5 states and 3 federal territories. The restrictions included rules like banning travel between states and districts, limiting travel to a 10-kilometer radius from homes, and only allowing 2 people per household to go out and buy groceries. Under any other circumstance, these measures likely would have had a positive effect. But MCO 2.0 was put in place after months of rising COVID infection numbers after the elections in Sabah. In fact, on the day MCO 2.0 was announced, Malaysia reported 2,232 new COVID-19 cases. In addition to its late implementation, MCO 2.0 was also not as effective as MCO 1.0 because more economic sectors were allowed to continue functioning, including night markets and restaurants. MCO 2.0 restrictions were later tightened and extended to all states except Sarawak till February 18th. MCO 2.0 restrictions were further extended for Selangor, Johor, Penang and Kuala Lumpur till March 4th. After almost 2 months of partial MCO 2.0 across the country, Malaysia was still reporting a 7-day average of about 2,000 cases in the first week of March. Despite this, on March 5th, every state in the country had transitioned from MCO 2.0 to CMCO, allowing most economic activities to resume. From the 6th of March to mid-April, Malaysia experienced a relatively stable period. Daily cases hovered between the 1,000 to 1,500 mark. Then, by mid-April, numbers went back up to over 2,000, then 2,500, then 3,000. Inevitably, in early May 2021, MCO 3.0 was re-implemented just 2 months after MCO 2.0. As numbers continued to rise, a total nationwide lockdown was announced. Then, it was extended by another 2 weeks to the 28th of June. Soon after, it was announced that the total lockdown would be extended indefinitely until daily cases fell below 4,000. On the day the indefinite extension was announced, 5,586 new cases were reported. It's hard to say for sure whether or not MCO 3.0 or the total lockdown could have been avoided if MCO 2.0 hadn't been eased so soon. But maybe a longer runway for MCO 2.0 could have curbed the spread of infections and increased the effectiveness of the restrictions. Since the pandemic started, you may have heard of the term positivity rate. A positivity rate indicates how many of those tested are actually infected. For example, if the positivity rate is 6%, that means that for every 100 tests conducted, 6 of them are positive. The recommended threshold set by the WHO for adequate testing is 5%. As of July 27th, Malaysia's positivity rate is hovering around 11%. A high positivity rate means that more testing should be done, as there might be more infectious people in the community that may not have been detected yet. On January 13, 2021, the Ministry of Health in Malaysia issued changes to protocol for contact tracing and swab testing. Due to the immense pressure on the healthcare system, they would no longer test every individual identified as close contacts to COVID-19 patients. Instead, they would only test those with symptoms. Close contacts who were asymptomatic would not be tested. According to various experts and researchers, asymptomatic people play a crucial role in spreading the virus. Some studies even show that anywhere between 50% to 86% of COVID-19 positive patients are asymptomatic. This decision to test only symptomatic close contacts was reversed in mid-February. The Malaysian Health Director General confirmed that the ministry had reverted to its initial strategy of testing all close contacts. Despite this, there are experts in Malaysia that still think there's insufficient testing being done in the community, as reflected in the positivity rate that remains high, making it likely that the true extent of the pandemic could be far more serious. Vaccinations in Malaysia had a slow start due to an erratic supply of vaccines. Almost 14 million people in Malaysia have received at least one dose of a vaccine, and 22% of the population are fully vaccinated. But vaccination rates are unevenly distributed across states. Areas like Kuala Lumpur and Putrajaya have successfully distributed first-dose vaccinations to a majority of their residents. But more rural states like Kelantan, Kedah, and Sabah have a far lower percentage, because of issues like lower vaccine literacy and more difficult access to healthcare. Vaccination efforts have been ramping up since June, so that number is likely to go up rapidly. But with the presence of the more transmissible and more infectious Delta variant, a slow start to the vaccination campaign means that it will take some time before Malaysia is able to live with an endemic COVID-19. As of the 28th of July, there are 1,050 active COVID clusters scattered throughout Malaysia. But if the entire country has been under a total lockdown for more than a month, where are these clusters still forming? Despite being in a total lockdown, 17 sectors, including manufacturing, have been allowed to operate at 60% capacity. Senior Minister for the Economy Azmin Ali claimed that of the 507 new clusters in the country between June 1st and June 23rd, 195 of them were linked to the manufacturing sector. Data from the Malaysian Ministry of Health has also revealed that nearly 1 in 4 people in workplace clusters tested are COVID positive, indicating that these workplaces are very likely a hotbed for the virus. Many Malaysian citizens have criticised this total lockdown approach as being half-baked. The phrase #TutupKilang began popping up all over social media, with some going so far as to leave comment chains on the Malaysian Ministry of Health's Facebook page. The extended MCO and lockdown measures have taken a heavy toll on the people of Malaysia. Most of society's most vulnerable people are being pushed to the brink of poverty, and an estimated 7 million more are at the risk of losing their jobs by October. Families are going hungry. Suicide rates are at an all-time high and morale is at an all-time low. But Malaysians, just like the rest of the world, are not ready to give up.
Selfless Malaysians have gone to the aid of those who have raised the white flag.
The least we can do as Malaysians is to listen to those who need help and to reach out to them in whatever way we can.
Think of 3 people that you think may need that text, may need that small call of, say, 3 to 4 minutes just to check in on them.
Here's to hoping and waiting for the day that Malaysia makes it to the other side.